I'm Gina. I'm a nurse practitioner student with USC, and I am going to be performing your physical assessment today. And so we did your vital signs already out there, and those were all normal, and they also checked your vision. We checked it with the Snellen chart, and your vision was 20/20, so that's looking good. So now we can start, and we're just going to go from head to toe. So we'll start with your head here first, and I'm just going to take a look at your head here, and just looking at the shape, and looking at your hair, and then I'm just going to feel, okay? So just going to feel your skull here, just feeling for any lumps, any bumps, feel any pain or anything anywhere. All right, so just gonna look at your face and just gonna look at the, the symmetry of your face. I'm gonna feel right here, these are your sinuses. And just gonna feel, are you having any pain, any pressure there when I'm pushing?
No.
No, okay, excellent. I'm gonna feel your temporal arteries here too. On each side, beautiful. All right, and now I'm gonna look in your eyes and just gonna check. First, just gonna looking at your eyelashes and your eyebrows, and I'm looking at the whites of your eyes, your sclera. The whites of your eyes are very white. That's perfect. I'm gonna pull down and look at the conjunctiva, and I don't see any drainage, no redness. Everything looks good there. I'm just gonna shine a little light in your eyes here. I'm just gonna check your pupils. So I'm looking at this one and your other one, and on this side. The other one, perfect. All right. So now I'm gonna have we checked your vision. Now we're gonna do your peripheral vision. So I'm going to have you look straight at me, just right at my nose here, and I'm gonna I have my hands out here, and I'm gonna pull them forward. And when you can see my hands, I want you to tell me, okay? So here we go.
Now.
Okay.
Now. Now.
Perfect. All right. Now I'm going to check the movements of your eyes, those eye muscles. So first, I'm just going to have you take a look at my finger here.
Okay.
And I want you to follow my finger just with your eyes. I'm going to look over. All right, and inside. Perfect. Okay. And now we're going to do a test where I'm going to have you cover up one of your eyes.
Okay.
And I'm going to have you look at my finger here.
Okay.
And I'll have you uncover your eye. Perfect. And I'm going to have you cover up your other eye.
Okay.
And look at my finger and uncover. Perfect.
Okay.
All right. That's great. Okay. Now that we've looked at the outside of your eyes, I'm just going to take a look actually inside your eye. Okay. And just going to check my thing here. Okay, and I'm looking at this side. All right, perfect. Okay, now let's move on. And I'm going to look at your ears now. And so I'm just going to kind of look at the outside of your ear. And I don't see any drainage, no redness or anything. I'm just going to feel your ears. Any pain when I pull on them?
No.
No? Okay, perfect. I'm going to take a look at the inside here. All right. And just going to pull back on your ear here a little bit. Look inside. And looking at your tympanic membrane, your eardrum. And it looks beautiful. It's nice and clear.
Good.
And shiny. And that's what we're looking for, so that is perfect. All right, now that we looked in your ears, I didn't see anything, nothing, that would obstruct your hearing, but I do want to test your hearing.
Sure.
So I'm going to have you actually just occlude or close up one of your ear, and I'm going to whisper something.
Sure. Apple?
Mm-hmm. And on this side?
Baseball.
All right, perfect.
Okay.
And then I'm just going to use my tuning fork, and I'm going to strike it, and I'm going to put it on the top of your head here.
Okay.
All right, and I want you to tell me what ear you hear it.
I hear it in both of my ears.
Both ears. Perfect. That's exactly right. Okay, now I'm going to strike it again, and I'm going to place this little part on the bone behind your ear,
Okay.
and I want you to tell me when you stop hearing it.
Sure.
And then once you stop hearing it, I'm going to put it right next to your ear, and I want you to tell me when you can't hear it anymore, okay?
All right. I can't hear it anymore.
Okay.
Can't hear it anymore.
we'll do the same thing on this side.
Can't hear it anymore. Can't hear it anymore.
All right, perfect. Okay. Now we're going to take a look in your nose.
Okay.
I'm just going to turn my little light on here. Okay, now I'll have you tilt your head back just a little bit. Just going to kind of push up on your nose. Sorry if this is a little bit uncomfortable. Just going to look at the outside and now on the inside. And I'm just kind of looking here at your nasal mucosa, the pink lining in there. It looks nice and pink. And I just looked at the, the septum, like the middle, the part that separates each side. Everything looks good. No deviations. Everything's looking really good there. All right. So now we're going to move on and we're going to take a look inside your mouth.
Okay.
Just put my gloves on here real quick.
I like the purple gloves.
Me too. Alright. Take that. I'll take this. Okay, so I'll just have you open your mouth for me. Perfect. And I'm just looking at your cheeks. Everything looks nice and pink. And I'm looking at your tongue. Can you lift your tongue up? I'm going to look underneath. Beautiful. Just going to look under there. Just looking at your teeth. And the top of your roof of your mouth. Alright. Now I'm going to put this little tongue depressor on here. And I have you say, ah.
Ah.
Perfect. Just looking at your uvula, that little dangly thing. Tonsils. Everything looks good. Alright. Alright. Now that we've done your mouth, we can move on to your neck. So I'm just going to kind of take a look at your neck, and I don't see any masses, no swelling, anything like that. Just going to feel your trachea here. Just make sure that your airway is nice and midline. And also I'm going to feel for your thyroid. So I'm just going to put my fingers here, here, and I'm going to have you swallow for me. Perfect. All right. Any tenderness at all there? All right, perfect. Now I'm going to feel for your lymph nodes. Okay, so I'm just going to start back here, and we're going to work our way up. All right, and behind your ear, and underneath your chin, and here. Okay, I'm going to feel down your neck, and this side, and right above your collarbone here. Perfect. All right. So that is going to complete our, head and neck for the moment, and we're going to move on to your cardiac exam. So I'm first going to feel for your carotid pulse. So just going to feel your pulse here on this side. Perfect. And on this side. Okay. And I'm also going to listen. So first I'm going to listen with this side, this flat side of my stethoscope. And this side, and then I'm going to flip it around and listen to this side. And this side again. Alright. And now that we've listened to your arteries, I'm going to actually have you lay down and I'm going to look at your neck veins here. Alright. So we have your head at a 30 to 45 degree angle, and what I'm looking for is just for some, distension in those neck veins. So I'll have you look that way, just gonna kind of look, okay, and this way, perfect. All right, so I do not see any distension, so no JVD, at this angle. All right, so I'm gonna kind of take one of these pillows away here real quick. Okay, now we're just going to continue on, and I'm just going to actually just kind of inspect your chest here. Just look at the rise and fall. All right, and now I'm going to feel. So I'm going to palpate or feel. I'm going to start right here on this side and this side. Down. And right under here, this is where the apex or this part of our heart, you can feel a pulse. And so I'm just going to feel for that pulse. Very good. I can feel it. All right. And now I'm going to listen. And I'm going to listen first, again, with the flat side of my stethoscope, and then I'm going to turn it around and listen with the other side. So first we'll just kind of there, perfect. And this side. Alright, just over here. And again. Perfect. Okay. Now I'm actually going to have you roll onto your left side, so roll towards me. Perfect. And I'm going to listen again, but just with this part this time. All right. And go this side. Perfect. Okay. Now I'll have you set up for me. Okay. So just a little bit more listening. Just going to listen here. Again, with just this part of my stethoscope, I'm going to actually have you just lean forward. And I'm just going to listen to this top part here. Perfect. All right. And one more time we're going to go through.
Okay.
And listen. And perfect. And last but not least, just use this other side. And one more time. Perfect. All right. And now we're all done with the cardiac portion of our exam. Okay, now we're going to move on, and we're going to move on to the musculoskeletal portion of our exam. So first of all, I'm just going to have you run through some range of motion exercises with your neck. So I'll have you touch your chin to your chest and back up, look up towards the ceiling. Perfect. And look side to side. And now put your ear on your shoulder and your ear on your other shoulder. Perfect. All right, now I'm going to have you push against my hand. Beautiful. And back. Perfect. All right, and side and side. Perfect. All right, so we'll kind of work our way down here. Just kind of check in, just doing some inspection here, making sure that everything is symmetrical. Everything's looking good. And just going to kind of feel your shoulders here. Any pain or anything when I'm pushing? All right.
So everything feels fine.
Feel down in your elbows. And I'm actually going to feel for your lymph nodes. Down here we do have lymph nodes in our arms, so I'm just going to feel those. And I'm going to feel the ones under your armpit. Perfect. All right. And I'll feel for these ones. And under this side. Beautiful. Okay. All right. So your arms feel nice and warm. Any wrist pain, anything like that?
No, everything's good today.
Okay, just looking at the joints in your hands and your fingers. And I'm also looking at your nails and your skin. Skin color looks good. And I'm checking your, we call it capillary refill. So just pushing on your nails here, making sure that they turn white and then turn back pink. And yours bounce back right away. So looking good there. All right, so now we can do some, actually there's a test that I'd like to do to
Sure.
test your wrists. So there's a test that we check for some carpal tunnel. So I'll check both your wrists. So I'm just going to kind of bend your wrist here, and I'm going to tap right here. That's right on your median nerve. And if you have any pain or any tingling, okay. We'll check this side. Perfect. All right. Excellent. Okay, so then there's also another test that we can do where you put your hands in prayer, and we're going to hold it like that for 30 seconds. And during that time, if you have any pain, any numbness, tingling, anything like that in your wrists or your hands, we would be able to, think that maybe something would be going on, in your wrist or like carpal tunnel. Do you have any pain at all?
No, everything feels
Okay.
fine.
Perfect. All right, there's one more test I'm going to do. And I'm just going to kind of hold your hand here, and I'm going to occlude both of your arteries. And I'm just going to look at the color of your hand. Okay. So I want you to pump your hand 5 times for me. Perfect. And I'm going to let go of this one, and your hand should turn pink, and it does right away. All right, we'll try this one. All right. Now go ahead and pump your hand 5 times. Perfect. All right. Look at that. Right away it turns pink. Beautiful. All right, so now we can do our range of motion exercises. We'll start with your shoulders, and so I'll have you lift your arms up as high as you can, and back, and we're going to push them all the way back. Perfect. All right, and now we're going to go out and back. So you can cross. Perfect. All right, excellent. And now I'll have you we'll see your elbows, so we'll have you flex and extend. And flex again, and this time I'm going to have you push against my hand, so push. Okay, now don't let me push. Perfect. Okay, all right, now we're going to look at your how your elbows move like this, like you're pouring something out. Perfect. Okay, now I'm going to look at your wrists, and so we can flex your wrists up and down and up. Okay, so now I'm going to push, don't let me push, and don't let me push. Perfect. And then out to the sides. Very good. And now flex your fingers up and flex your fingers down. Beautiful. Now open and close. Excellent. And now I'm going to have you squeeze my fingers just like that. All right. Excellent. Okay. So upper extremities, everything looks really good. And we're going to move on, and we're going to check your lower extremities. And so to do that, I will have you lay down. So we'll lay down. Okay. So first, just going to kind of take a look at your hips here, checking for symmetry, making sure everything looks good, and just going to feel down your leg. I'm just feeling the bones in your knees, and here, and down, both sides. And I'm just going to kind of look at the color of your legs here. And your skin is nice and smooth. You must have just shaved your legs.
I did. I knew I had an appointment today.
All right, so now I'm going to just feel your pulses in your knee. So you can just kind of bend your knee. Perfect. And I'm just going to feel pulse in the back of your knee. And this one. Excellent. And I'm going to feel the pulse on the inside of your leg here, and here, and the ones on the top of your feet, and here. And I'm also just kind of feeling that your skin is warm, and I'm looking at the color, and I don't see that you have any swelling. Just kind of pushing on your feet and your ankles here, and I don't see any swelling, so everything looks good. Okay, so now we can do some range of motion with your lower extremity. So we'll start with your hips, and what I'll have you do is I'll have you bring your leg up as high as you can, up, perfect, and down, and then you're going to move it out and across, perfect. And we'll do the same thing on the other side with your leg up and down and across and over, perfect. Okay, now we'll have you do your bend your knee up towards you, perfect. And out, same thing, up and out, excellent. And now can you flex your feet up towards the ceiling and push your toes down, perfect. Okay, so now that you're sitting up, actually there is one thing that I wanted to do. I do want to check your radial pulses here. So we did all those tests on your wrist, and now I want to just actually feel for these pulses here, perfect. Okay. Now I'm gonna check the strength in your legs.
Okay.
So what I'm gonna do is I'm gonna put my hand right on the top of your thigh here, and I want you to try to push my hand up. All right. And now try to push it down. Perfect. And same thing on this side and down. Perfect. Okay. Now I'm gonna have you push back on my hands. Perfect. Now push up. Excellent. And push down. And don't let me push down. Okay, excellent. Whoa, you're about to knock me over. All right, so now I'll have you stand up. And when you stand up, I'm just going to take a look at your back here. So I'm just going to kind of look right now at the symmetry of your spine and just kind of feel here. So starting right about here, I'm just going to kind of feel my way down your spine. Excellent. And you've got a nice curvature to your back this way. And what I'll have you do actually is just kind of bend over and touch your toes for me, and that'll check how your back moves, and then you can stand up. I'm just looking at your hips at the same time to see if they're symmetrical. And if you want, if you could just lean back just a little bit. There we go. I know that's a hard one. Okay, perfect. All right, so now I'm going to have you walk for me, and I'll just have you walk a couple steps, just regular. Perfect. And then now I'll have you actually walk on your heels. So if you just take a couple steps like that, perfect. And then if you want to walk back the other way on your toes this time, excellent. All right, so everything looks good. So that actually is the end of our exam.